Today, an insurance company infringed on my practice of medicine. Nope, sorry. I know my colleagues are doing this, and kudos to you. Keep up the good work. Keep posting about this, but this just isn't me. Let's try this again. Welcome to another edition. Automatic readings of prior authorizations. My patient who has type 1 diabetes has Oscar for his insurance. And they suck. They suck the big one. You need a prior authorization for pretty much everything. And he has a quantity limit on how much insulin he can get. Having said that, there was some whispering that he could finally get an insulin pump. And so we sent in the prescriptions for an omnipod and for dexcom 7. And yes, they needed prior authorization. They did approve the dexcom, but they did not approve the omnipod. And the reason that they didn't approve the omnipod was because there was no evidence in his chart that he had received diabetes education. He was diagnosed with diabetes about 20 years ago, and I started seeing him about 14 years ago. So I don't have the documentation that he received the education that he received when he was first diagnosed. And so in order to comply with Oscar's requirement, he attended diabetes education. So then I sent an appeal saying, happy now? He did diabetes education. And then they sent back a letter saying that we needed to get written consent from the patient for me to do the appeal. Like, I'm just going to volunteer to do an appeal for something against the patient's will. So we now have a letter from the patient giving consent for me to do the appeal. We sent that in, as well as my appeal letter again, and the note from the Diabetes Education Center that he had diabetes education. We'll see what happens.